Um, is that on everyone's screen? Yep, I can see a nod. Lovely. Well, thanks everybody. I've been asked to provide you with an insight into the area of homelessness, and my intention is to talk about kind of figures, so the recently released statutory homelessness statistics. I thought it would be useful to also bring in some of the findings from a report that we've just released called The Unhealthy State of Homelessness, which is derived from various homeless health needs audit completed across different parts of the country, and then also to just bring in some examples of resources that you may want to access on homelessness and self-neglect. Just in terms of Homeless Link, what we do, it says it up there, but we are the national membership charity for frontline homelessness services. We work to improve services through research, guidance and learning, and crucially campaign for policy change that will ensure everyone to have a place to call home, and most importantly, for the people that we're talking about today, the support that they need to keep it. And we've got just under 900 members across England. So if we can start with just some definitions, I think it's important that not all people facing homelessness face the same challenges, and crucially, as a result, some people facing homelessness are not as visible as others. You can see the different definitions there, and if I talk about the statutory homelessness, a lot of you will know that local authorities have a duty to find a home for families or individuals approaching them who fit the priority need criteria, and these households are initially offered temporary housing such as private rented accommodation, nightly paid accommodation or bed and breakfasts. But as I said, within it there is this priority need criteria, and these are households that would with dependent children, pregnant women, and those threatened with homelessness due to an emergency, fire, flood example, and also those who are vulnerable. And the vulnerable bit is the important part, and how that is defined and how people are supported to be able to demonstrate that. The crucial bit of legislation is the Homelessness Reduction Act, which came around in 2017. And what that does, it places a duty to prevent or relieve homelessness of all eligible people threatened with homelessness within 56 days. Individuals experiencing homelessness, individuals and couples without dependent children who are homeless and don't meet that priority need criteria, therefore do not qualify for accommodation from their local authority. As a result, many stay in short-term accommodation such as hostels or supported accommodation provided by homelessness charities. They sleep rough or they remain hidden. And if I touch on those two final elements, rough sleeping is the bit that a lot of people say, well, that's homelessness. That's the most visible form of homelessness. It includes sleeping anywhere outside or in buildings not designed for human habitation, such as stairwells. You can see people at train stations, coach stations, or even in cars. But the most important one, I think, actually, for the type of people that we talk about, are hidden homelessness. Now, these are many people who become homeless and aren't counted in the official figures. They might not ask for or be entitled to help with housing, and so they won't receive the support that they need. As a result, many sofa surf with family and friends or sleep out of sight in those hostels, squats, on public transport or other insecure and unsuitable accommodation. And it's those people who really we need to try and find and target where we can. In terms of the stats, on the 22nd of September of this year, the Department for Levelling Up Homes and Communities published its latest set of statutory homelessness statistics, and they look at the financial year between 2021 and 2022, capturing data on everyone who's been assessed under the Homelessness Reduction Act. And what we've seen is a large increase in the total number of households assessed as at risk or experiencing homelessness compared to 2020-2021. Overall, 278,110 households were ordered duty in that duration of time. And what that represents is an increase of 3% from the previous year. Now, that's really, really important to be aware of. And it's important to be contextually aware of the living costs, obviously, that everyone are experiencing. They increased dramatically during 21 and they have continued to do that into 2022. And with that period of time, that was the same time where a lot of the government support that was provided through the pandemic came to an end. Across the statistics, there are many worrying signs that many more households are losing their tenancies due to rent arrears, evictions, and landlords themselves wanting to relet and sell their properties. as you can see there, 50 cent, there was a 50% increase of people coming from the private rented sector. And worryingly, what we're starting to see are that there are more households where the lead applicant is actually employed being at risk or of experiencing homelessness, which was up 16%. Not something that's always associated with homelessness, is that, you know, everybody will be unemployed, everyone will have all these different stigmas that can be attached to it. Actually, as we've often heard, homelessness can impact anybody in irrespective of their circumstances. And what's really quite interesting, again, in relation to the people that we're talking about today, so those who have support needs, evictions from supported housing have also continued to increase beyond any figures that we've seen since the start of the Homelessness Reduction Act in 2017. During the financial year, 4,270 households were owed a prevention duty after being evicted from supported housing, and that was up 40% from the previous year. What that also is cutting across into is, in terms of the overall number of 278,000 there, we're seeing a greater proportion of households who are claiming and have support needs. And what that's meant is that the lead applicant in there for 52% of households are now being seen as having a support need. That's 143,000 of that overall total. And the kind of needs that are coming through are an increase around physical health support needs, up 16% from the previous year, a history of mental ill health, up 8%, and also an increase due to unfortunately experiencing domestic abuse, up 10% from the previous year. So those are the statistics. Those are what we're talking about in the most recent financial year. If I can move on to a recent report that we've published called The Unhealthy State of Homelessness. And so since 2009, Homeless Link has supported local areas to undertake homeless health needs audit to understand the health needs of people experiencing homelessness in their communities. The health needs audit is a survey and methodology developed by Homeless Link with the support of the NHS, local authorities, and also our members. It presents data captured from 31 audits carried out between 2017 and 2021, which follows on from previous audits undertaken since 2009. What it sets out is not only the updated health needs of people experiencing homelessness, but also how they've changed over time. The health need audit covers 5 areas: physical health, mental health, substance misuse, access to services, and well-being and preventative healthcare. And so what is it telling us? What's the big picture? I'm not going to go into great detail in this because I was always conscious of the time that I had. But what we're seeing is that the health of people experiencing homelessness is worse across the board, but particularly their mental health. What we are finding is that from the first wave of audits undertaken between 2009 and 2017, where 45% of people stated that they experienced a mental health problem, that's now reached 82%. So not quite doubled, but quite significantly increased. What we're hearing is that there is a gap in every instance between the support that people feel that they need and the support that they're able to access, that I think links to some of the things that have been said. But it is most stark for people who are dealing with a mental health condition. There is some positive from where we've seen things before. Obviously, there has been a history of homeless individuals not accessing and being able to get primary care provision and GP registration being a problem. What we're hearing is that actually the GP registration is now much higher than it previously was. 97% of people within this reported that they had registered with a GP or a homeless health centre, which is a great increase from what it's been before. But crucially, what we are still seeing is that people with and are experiencing homelessness are still likely users of emergency healthcare services. So what we're seeing is that there's 3 times still the attendance at accident and emergency for people who are experiencing homelessness rather than through primary care provision. What we're also seeing, and again this links probably to what Mike was talking, is that people not getting the support that they need leads people to self-medicate, which does perpetuate that cycle of poor health and homelessness. And what we are seeing, which I think is quite crucial here, is that many people have health needs when they become homeless, especially around mental health. What we heard was that 72% of the people who were involved in this had experienced and had been diagnosed as having a problem with mental health prior to becoming homeless. And interestingly, 44% of people had physical health problems which predated an experience of homelessness. So what that says is that homelessness has a devastating impact on people's health and well-being. The findings set out in the report and captured from the health needs audit demonstrate a stark narrative of health inequalities. And I just think it's important that you bear all of that in mind when you are aware that someone is experiencing homelessness, that actually not having a home is likely to be just the tip of that iceberg. So just to finish, because I'm conscious of time, is just to draw your attention to a few resources that are available and that I would suggest that you look at. Obviously, as part of this, the series of handy resource guides are being produced, and I have to say the one on self-neglect and homelessness is really, really good.